I am a MIPS Professional Services Consultant here at Next Tech, and with me today, I have Heather Miller, Senior Professional Services Consultant, and we're going to kind of go over the proposed rule that just came out here last week and the changes that they're proposing for 2024, and then we will kind of go from there. Now, this information provided in this webinar does not and is not intended to constitute legal or other advice. Instead, all information, content, and materials are available for general information purposes only. Information in this webinar may not constitute the most up-to-date legal, financial, or other information. Webinar attendees should contact their attorney, financial, tax, or other advisor to obtain any advice with respect to any particular matter. This webinar contains links to other third-party websites. Any such links are provided only for convenience, and Next Tech does not recommend or endorse the contents of any third-party sites. And just as a reminder, we'll go ahead and we'll send out a recording of this webinar to everybody at the end. We know that's always a nice reference point for everyone to have. So just so you know, this is being recorded and we will provide that link to you also. Our agenda for today is we're going to go over the MIPS proposed changes for 2024. We'll take a quick look at MVP's MIPS Value Pathways, why you should stay and continue to do MIPS in 2024 and beyond. And then there will be a live question and answer session with myself and Heather to make sure that we cover any questions that you guys may have. So we're going to go ahead and start today with a poll question. Are you considering MIPS reporting for the first time this year in 2023?
Like we're getting a few answers here. If everybody's all the way logged in.
Like we have anyone who's new. Yeah, correct. It looks like we might have some veterans.
Got a bunch of veterans.
For sure.
We'll take it, right? All right.
Always.
We'll go ahead and close that out and get started on these.
So we're going to go ahead and dive into the proposed changes in that proposed rule, like I said, for 2024. Again, I like to preface, you know, everything is proposed. It hasn't been finalized. Once it is finalized, we'll take the time to communicate that out to you too. You're still going to have your same MIPS reporting options in 2024. You have traditional MIPS, which is the majority of what our clients attest to. MIPS Value Pathways, which is new. It was available in the 2023 reporting year, but is definitely ramping up as we get into future years. And then alternative payment models, APMs, or performance pathways, APPs. There is going to be a new collection type of data, Medicare CQMs, but they can only be reported through the advanced payment pathways. Now, another suggested change, and this is kind of a big one, is that they are proposing to move the threshold from 75, where it has sat the last couple of years for 2022 and 2023, up to an 82. They do calculate this score, and I believe it's in the law even, and Heather, you can correct me if I'm wrong. Either way, the statute does say that they need to take the mean of the final scores from 2 years prior to continue to kind of up the threshold for the years coming.
That is 100% correct.
Your 2024 category weights are going to stay the same. It'll stay with quality at 30% of your overall score. Cost will stay at 30% of your overall score. Improvement activities will be 15, and promoting interoperability will be that remaining 25. Unless, of course, you get a small practice reweight and need to have any categories reweighted for you for whatever reason. There is no proposed change to category weights. Now the 2020, sorry, The 2024 penalty is going to swing that full 9%. So if anything, if a 0 is going to be a full 9% penalty, and then 100 can be up to, I believe that they have suggested we get to it later, but an 8.33 or a 6.3, something along those lines. Heather will talk about that more to come. But keep in mind, there is a difference between a 0 and a 56 and a 74. It's better to submit any data than no data at all and receive that full 9% penalty. We would, of course, want to get any amount of data we had into the system that we could. And what we're always looking for is, of course, in that positive payment adjustment, to be able to make sure we're maximizing the money that you guys get back for the work that you are doing. Now, quality is going to remain the same at a reporting period of 12 months. We're still looking at that same 6 measures we've been submitting here for the last couple of years, with one of them being a high priority. There isn't a change to the new data completeness standard that will kick off in 2024 and 2025. That was proposed and finalized previously, where right now it's only a 70%. We will start that 75%, and then they don't have a proposed to change that for 24 or 25. However, there is a proposed to kick it up to 80 in the years of calendar year 25, 26, and then going forward. Quality measures are going to function the way that they always have. Each required measure can be scored against a benchmark, will receive 1 to 10 points. Achievement points. Any measure then that doesn't meet the case minimum, which is 20, your denominator always has to be 20, or the government just doesn't consider that a viable data point, or the data completeness standard, that will receive 0 points, except if you're a small practice, you'll continue to earn 3 points for those measures. And then for every required measure that nothing is submitted, no data has been reported, that measure will receive 0 points. All right, so quality measures as a whole, they are introducing 14 new measures into play. They're proposing the removal of 12 different quality measures. There is substantive changes to 59 of those. So you're going to want to make sure that, we've taken a look at the specs and that you've gone in and seen what those changes are for any measures that may affect you that you're used to reporting. And then 3 measures as a whole are going to move to MVP, MIPS Value Pathways reporting only. So the 14 new quality measures in existence are these. There isn't really any that particularly pertain to the ortho specialty, except I do want you to take a notice of the one that's in red, the preventative care and wellness composite measure. We're going to talk a little bit more about that in the coming slides. But there is some interesting things that you can see here on this slide of really kind of what the government is focusing on as they go through and create new measures for us to attest to. I think the other thing that's interesting is if you take a look at, the second one on the list, this ambulatory palliative care, patients experience feeling heard and understood. That is a patient reported outcome. That is going to be, for the first time ever, a measure that really starts to look at the patient decides whether or not we meet or pass or satisfy that measure. And so I do think it's interesting to take a note that is kind of what the government is going for a little bit by releasing measures like that. Heather, do you have anything else you want to add on these 14?
I think that's a perfect synopsis, because I think patient-reported outcomes is an interesting component. And obviously you have a choice in choosing, but having 3 new measures that are all patient-reported kind of shows the direction that they're really looking at patient care, and they're going to ask them how they feel about it. So I think it was a great overview.
Perfect. Now, the 12 measures that they are slated to remove also probably are not going to affect ortho in a big way. Nothing that, the majority of at least our clients are submitting to. I do think it's interesting, though. Again, I always find it interesting what the government adds and what the government does take away. You can really kind of get a feel for what their focus is. as they go through the years and do, you know, measurement adjustments. Now we are going to take a look at the quality measures that we have and the updates that have been set to measures that would affect you. So the updated change for the functional and total hip replacement is they're going to change that factor exclusion from 2 at a time to 1 lower body fracture, update the time for follow-up assessment from 300 to 425 days after the THA procedure. For preventative blood screening and follow-up, they're going to update that denominator criteria to include audiology codes. Controlling high blood pressure, they updated that numerator and denominator note to about patient reported data, and it is the clinician's responsibility and discretion to confirm that the automated blood pressure monitor used in sorry, I just had a neurological event, please forgive me, that is being used is considered acceptable and reliable. So that will be up to the clinician's discretion. We have a couple of other updates here, one on tobacco. We're going to combine the patient population of QPP 04, which was that tobacco cessation adolescent measure. It is slated to be removed. So one of the ways that they're going to kind of compensate for that is to tie it into the big CMS 138 tobacco measure. It will now open up from patients 18 and above to patients 12 and above. So that patient population is slated to now be included in that measure. And then for high-risk medication in older adults, we're going to update that medication table for ECQMs to align with the current guidelines. They just kind of add some logic around those medication ordered on the same day, and then, but if they're intended to start on different dates. So there's just some added logic being added to that measure. Awesome. So as we talked about it, there are 3 measures that are going to be moved to MVP only, and that's going to be breast cancer screening, colorectal cancer screening, and body mass index. What's happening for traditional MIPS is they're going to add a new measure. We talked about it slightly. It's this preventative care and wellness composite measure. It's going to compose of 7 different kind of past quality measures that we have had in the past. They're basically going to throw them into one whole measure. It's going to include influenza, the pneumococcal, mammograms, colorectal cancer screenings, documented BMI, so the BMI measure goes there. Tobacco will feed into that also, and then screening for high blood pressure. It will be those 7 different data points. However, what I do want to tell you is the government kind of hasn't given us any logic on how they're really intending to score that. Is it just going to be an average of all 7? Are they going to look at one specific stratification at a time? I don't think we have a whole lot of guidance on how it will be scored, but we do know that they're going to tie them all together for traditional MIPS into one composite measure. Heather, do you think anything else on this slide?
Yeah, I think that's a great, again, scenario. And what we're looking at there is they're taking, 7 current measures. They moved the vaccination measures last year to the MVP only. Now they added these 3 and then created this preventative care and wellness measure for traditional MIPS. So interesting way that they're kind of pulling them all together, and we'll see with benchmarking how that's going to look when it comes out. So.
All right, promoting interoperability. Now this category is going to catch quite the update. For years it has been any consecutive 90 days. Then they are proposing that we move that now to any consecutive 180 days. So instead of 1 quarter, they're going to be looking at 2. It doesn't actually have to be a quarter, just any consecutive 180 days period throughout the year. And we're still looking at those same 4 reporting objectives. Now, for promoting interoperability, you must attest yes to a couple of things. And one of the big things about that is you have to attest yes that you do use a 2015 edition ONC certified CHERT software. You also need to attest to your security risk assessment. That is not just a requirement of promoting interoperability. It is actually a requirement of HIPAA and OCR, the Office of Civil Rights. So there's kind of no getting out of that one. We just attest to it during promoting interoperability. You have to attest yes to the SAFER guidelines also. And then the other thing is you do have to attest that you did not, I missed this first point here, we'll go back up. You did not attest to information blocking. At no point did you block that information. So you attest yes to the actions to limit or restrict compatibility of interoperability in your CHIRT. Those are really the big important 4 things that come with that promoting interoperability attestation. And Heather, actually, I'm going to go ahead. I'm going to let you talk about the SAFER guidelines just because I do know that you're more informed.
So the SAFER guidelines were part of our 23 final rule, and you actually were given the opportunity to attest yes or no and still be able to report the PI category. In 24, the proposed change is that it will be now required that you report yes to completing the high priority practices component of the SAFER guides. So if you were to pull up the SAFER guides, and you can literally Google SAFER guides and it will pull up the website. It is a very user-friendly website where you can click on the different guides and it'll take you through a step-by-step scenario of completing it. But for the purposes of the MIPS proposed rule, it is stating now that you must complete at least the high priority practice foundation guide and report yes in order to complete the PI category. So that is new for this year, where last year there was some leniency. Now they're saying they're going to make us at least complete this component to report PI. So that's the main change there.
Perfect. The other changes that happen in the promoting interoperability category is we do get this new cool exclusion. When it comes to the PDMP, the prescription drug monitoring program, there is a new exclusion for providers who don't prescribe any Schedule II or above substances. That wasn't a option in the past, and there wasn't a whole lot of logic about what to do with those providers, so that now does exist. The automatic reweighting for a small practice does still exist. Any group underneath 15 providers can automatically have PI reweighted. And then again, we're going to increase that performance period to a minimum of 180 consecutive days. Now, the promoting interoperability objectives are going to stay the same as we've known them, at least for the last couple of years. There isn't any update in scoring on the measures that we know and love. So we will just continue to do as we have done in the years past. For improvement activities, again, we'll be looking at 90 consecutive days, and then a requirement of 50% of your providers do need to be involved in that improvement activity for you to be able to attest yes to it. That is a requirement of it, but neither of these are any updates from 2023. This remains the same as it has been. We do have a few proposed new improvement activities to the list, and they are going to propose a removal of 3 improvement activities, none of which are any of the kind of big massive ones. However, they do seem to be adding a new practice-wide quality improvement measure for MIPS Value Pathways, and that is interesting, especially to orthos who are looking at going down that path. There will be, you know, that dedicated improvement activity for those providers, because keep in mind the government's goal with this category is to give you credit for the things that you are already doing. So it's nice to see that they have a new improvement activity out there for you. Now, there is a proposed change to improvement activities. This use of clinical support and standardization treatment protocols to manage workflow in the team and to meet patient needs. It's going to have a new title. It's going to be used decision support, interoperable clinician decision, CDS tools, and standardized treatment protocols to manage workflow on the care team and to meet patient needs. So if this is one of the improvement activities that you use, you're going to want to go ahead and go out there, check out its new name, and make sure that it's still asking you for the same things that it always has. Now for cost, Again, you're looking at the 12 months that we've had for 2022. I mean, we've always had costs. It just finally did come into play. And you will have noticed that if you went out and checked your final scores that have now been released on the QPP website. Cost is there. It is noticeable. It is definitely taking its 30% of the score, and we're all kind of adjusting to that. Again, that is a claim-based submission. That is all under the control of CMS, and they're the ones who also, make sure they pump out the data on that measure too. Now they are going to add 5 new episode cost measures, one for emergency medicine, one for lower back pain that may end up pertaining to some physical therapists. It is the cost measure that's in a new proposed MVP for them. So of course, then that's why it ends up on this list too. They have upped your cost measures to a 20 case minimum. So if you don't have more than 20 episodes, then they will not attribute you to cost. That is up. There's some cost measures that sat at 10 for years, and now everything is at 20. So they are going to remove one of the cost measures also, but it does not have a big impact on ortho.
And I will say, just to add in a tidbit from what we've been seeing in the results from the 22 reporting in the first year and 3 years that we've received any cost feedback is in orthopedic, you have about 5 measures that potentially could be impacting your cost score from the basically the 2 general ones, total per capita and the Medicare per beneficiary. And then we've seen the hip surgery episode measure, the knee, and then also there's a lumbar fusion. So I have had groups I'm working with who have been scored on 5 separate cost measures and have been provided data files for each of those measures, and then again where they fall on those benchmarking. So definitely an area that orthopedics are going to see and can potentially have multiple measures. And then looking at this one, the low back pain also being probably pulled into the mix. So cost is something that definitely is going to be a high priority in years moving forward, to make sure you're looking at that data, understanding where it's coming from. With it being claims-based submitted, really looking at the code files and getting into those and understanding them is going to be your best way to ensure you're following that protocol. So just something I wanted to jump in and add.
So now there is a comment submission section. If you would like to have your voice heard, we do suggest, you submit comments on any feedback you would like to give to the government. That will be open until September. We fixed this yesterday, Heather. We're sorry, you guys. This is a misprint in our slides. That doesn't close in 2024. That will close September 11th of 2023. I'm sorry. I thought we caught that one. And so you can submit those either electronically through regulations.gov, or you can always write a letter or have it overnighted. But the government comment submission period is open, but will be closing in the next couple of months. So you want to make sure you get those in if you have them. Awesome. We're going to jump into another poll question. Make sure everybody's awake out there. Are you looking for new ways to improve your MIPS score? I think the answer is kind of always yes on this one, right, Heather?
Right? That's what I was just about to add. I'm assuming everybody out there wants.
Yes, ma'am.
We all have that magical wand, right? All right, well, we're going to take that as yes. Everybody does want to jump in and learn a little bit about how they could do better. So we're going to kind of jump into the second part of our agenda and do a quick look into MVPs. And what is an MVP? It's a MIPS Value Pathway. And this is a commitment by CMS to transform MIPS to the MIPS Value Pathways from traditional MIPS as we see it today. It's a new participation framework, and it says to be implemented in the future, but yet it kind of came into play in 23. And there is a whole timeline of transition for this to take place on and through I think 2028 is when they would like to see it at full attrition. So why are we moving into this MVP model? CMS says it's what they've heard from clinicians. You know, they've heard that the current MIPS program is too confusing. They believe there are too many choices when selecting measure, which makes the process too hard. Many measures are not relevant to our provider specialties, and patients can't really compare performance between providers when we're picking from such a large list of measures. What one provider picks and another provider picks could be totally different, but yet they're being compared in the physician compare for those. So based on all of this, the MVP model has been created. And the timeline of this is to really give a gradual change from traditional MIPS, where if you see in this diagram on the left side, we have 4 different quadrants of our categories: quality, promoting interoperability, improvement activities, and cost. And they all function on their own. They've got their own means, and you've got your requirements. And then over the next 3 to 5 years, they see us merging these into one single quadrant with overlap. And so specifically with quality and improvement activities being aligned, and then creating a foundation level for that promoting interoperability, population health measures, enhanced performance feedback, and any patient-reported outcomes. So this is the plan. They're not looking back. If you read the proposed rule, they are moving forward with this and looking for that full implementation by 2028 and having MVPs for all of the different specialties. So talking about some of the options and why you would choose to report an MVP. Right now it is voluntary. You could choose one of the MVPs that are available and or report traditional MIPS. You also can do both. And if you do both, they would then basically score you on the one that you did better on. So in MVP reporting, we still have a quality performance. What is different is they give you a set of measures to choose from. It's a shorter set of measures that are specialty specific, and you would select 4 quality measures to be included in your MVP list. And the improvement activities, they do the same thing. They drill down from the 100 or so that are out there into a list of 8 to 10 that are, again, more specific to that MVP specialty, choosing, again, 1 high or 2 medium, dependent upon your practice size. And then in the cost performance category, they are going to assign cost measures that are specific to that MVP, again, would be scored the same way. One of the things that they're adding is a population health measure. There are 2 population health measures listed here. The practice will give the opportunity to choose which one they want to be scored upon. That would then become the 5th quality measure in your reporting. So this is kind of how it would work. And then now let's look at a couple of examples that make it a little bit more relatable to the orthopedic specialty. So 5 of the new proposed ones in 2024 are focusing on women's health, quality care for ENT, prevention and treatment of infectious disorders, quality care and mental health. And then we've got this rehabilitative support for musculoskeletal care. You'll see on the right side of the PowerPoint that this is a MVP that clinicians who practice in the following specialties may want to consider. There you see your chiropractic, your physical therapy, occupational therapy, nurse practitioners. So this might be something that one of our ortho groups or an ortho group may consider to look at in the 24 reporting year if it gets finalized. They do provide a great file that'll show you the quality measures that are listed, the improvement activities, and you can do a review to say, hey, can we report 4 of those measures and would we prefer to? And you can notice here under quality that BMI measure that has been removed from traditional MIPS reporting is now available only in MVP reporting. So if you're reporting BMI currently, next year under traditional MIPS, it will not be an option, but under MVP it will. So when you're evaluating that list of measures that you have either within your electronic health record, if you're working from a registry, do you have 4 measures in this MVP that could become the means of reporting for 24? So definitely want to dig into this data and really see what those lists look like. So looking at a measure or an MVP that was available last year is improving care for lower extremity joint repair. This one specifically has been written for orthopedic surgery. So we wanted to spend a little bit more time looking into the details of this one to see and look at any viability as this being an option for our practices to report in 24. So for this particular one, when we look at the proposed MVP for the lower extremity joint repair, you can see under quality, we have the following measures. We have 24, which is the communication with physician on ongoing care post-fracture. And you'll notice the collection type. So this is still a measure that can be submitted using Medicare Part B claims, meaning there's a G code that you could be adding to your claim report and still report this measure. Then you've got your BMI measure, which can be submitted either ECQM or using a registry or even Medicare Part B. And then we've got the total knee for 350 and a total knee or hip 351 that only can be reported using that MIPS CQM specs, which would be working with a registry. Then we've got the functional hip assessment, which is an ECQM measure. And then you've got functional status after primary total knee. And then you've got this one that's actually an administrative claims submission method, meaning it's going to just come straight from your claim form. So in looking at that list of measures, 1, 2, 3, 4, those are 4 measures that technically, if you're in our platform at NextTech using SRS, you could pick these 4 measures, but the one main change is you would have to choose this one with the Medicare Part B. If not, you would need to work with a registry to be able to do the submission of some of those other measures. But really something to drill into if it's something you would want to consider. Can you pick 4? And do you know the submission methods that are available? Now, looking at the improvement activities, this is the specific activities listed in this MVP. Any of these are available for you to choose. You remember you either pick 1 high if you're a small practice. If you're a large practice, you would need to pick 2 high, 4 medium, 1 high, 2 medium, kind of however that fits. And then you'll notice here in the cost category, we have elective hip and then knee. So we only have 2 cost measures impacting at the MVP level, where at traditional MIPS, we're seeing both the MPRS measure and the total per capita being included in cost. So you really want to evaluate these 2 options of traditional MIPS or MVP and say, hey, where could we, end up scoring better? One of the other things here is obviously that population health measure, also going to be claims-based. So with claims-based measures, little hard to evaluate our performance until we get that information. So pros and cons on both sides, but want to make sure you guys clearly understand those options are there for you. This is how you can evaluate those decisions to say, hey, should we, opt in for MVP reporting and give it a try? Maybe do traditional MIPS at the same time so you can kind of pick which one you score better in. But with this being the way things are going, we really need to start putting our brain into this thought method because they're not really looking to go backwards. So this is really where in orthopedics, you guys kind of have one of the first options to really try this out when it's an option to report versus it being required. Again, here's the details on the musculoskeletal care MVP. Here are the quality measures related to this one. Again, you can see the submission type options. Here's the improvement activities listed for then. And the only cost measure that would be, if proposed and approved, would be low back pain. So really something to just dig into to say, hey, could this be something we could report and decide on as a group if that's what you want to do. So jumping into another quick poll question. Are you planning to change your software platform and have a need to understand MIPS better? So I don't know if anybody out there is in that, should we change, should we not, or could we do a better, little more effort in understanding MIPS better? So hopefully if anybody's out there and can give us a little feedback, that would be wonderful. All right, we got a yes. We always like that. And I know this one's like a 2-point question, so hopefully if we get to the Q&A, you can ask some questions on what you're looking for, either in a new platform or in understanding MIPS better. So, all right, Megan, are you wanting to jump back in?
Yeah, I would love to. I think I might have gotten us a little stuck here. Oh, I think I picked perfect. Okay.
There you go. We're going to
So
get into now why should you continue MIPS in 2024? And the main reason we're really saying that is that there really has been a decrease in engagement over the last few years with COVID. We had a lot of complacency with EUC policies that were allowing things to get reweighted automatically. You didn't have to report. And then I'm going to go ahead, Megan. My doggies are talking, so you can.
you're totally fine. I'll take right over. So yeah, there was a decrease in engagement, and I think a lot of it had to do with the fact of COVID. You know, that EUC came automatically attached and just assigned whether you submitted data or not. So any provider kind of leading into COVID who was still really anti-MIPS, they just kind of got a free pass for a few years. And so one of the reasons the government is really kind of ramping stuff up is because they want to be able to get that engagement back. And that is prevalent. If you go and check your final scores for 2022, and if you're one of those special people who has a perfect 100%, you can tell that within their methodology. So 5 reasons, the top reasons to stay in MIPS. I can't afford to lose any more money on government regulations. We understand that all you have to do is earn that 75 points to avoid that 9% penalty. You go budget neutral at that point. I don't want to give my money to any other providers. You know, MIPS is a budget neutral program. It was set up that way in the beginning. So the losers pay the winners. And we definitely don't want any of our clients to be losers for sure. I want to continue to collect more money on my Medicare payments. Achieving positive points and getting those positive payment adjustments is just money back in your pocket. And I will tell you on MVPs, one of the things the government has said is that those will be highly incentivized. They haven't used those words since the beginning of meaningful use, but they also haven't given us any information on how much money that could be, but they are willing to use that phrase. And I want to see great scores on the Physicians Compare website. Please keep in mind that is where your MIPS score does go to live. So anybody in the public, any patient, they can always log into Physicians Compare and take a look at how you're doing. Now, the 2021 payment adjustments, you can see that after this year in 2023, they are going to be removing that exceptional payment bucket. And I'm sorry, let me go ahead and rephrase that. 2022 was the last year that you could submit and you could still get an exceptional performance bucket. That has been removed now from 2023 going forward. And that is where the majority of money has been coming from for the MIPS program for a few years. So we are sad to see that go. However, the government again has proposed that even without the exceptional performance category, and I think this is the next slide, Heather, we're still slated to look, at what could be a positive payment adjustment of an 8.82. So especially with moving that threshold up to the proposed 82, there will be more providers who will catch a negative payment adjustment. And that is where they're banking on still being able to get that money and that it will still be available at those high percentages. Now, frequently asked questions, we'll go ahead, we'll run through some of these. How do I stay on top of the changes within the MIPS program? How do I monitor my MIPS score and make sure I'm maximizing my points? Where do I find training at NextTech for the NextTech software? How do I know what I've scored on previous years? Should I apply for a hardship exception application for PI? Are there any hardships for COVID in 2023? And if it's too late to ask for any help here for MIPS in 2023. So how do I stay on top of changes within the QPP? There's about a million ways. There's a bunch of different listservs out there. In fact, if you signed up for them all, you would get 13 emails a day. So you can always sign up to receive emails from the CMS listservs. That's really where you're going to get that most up-to-date information, especially on MVPs. You can attend webinars just like you're doing right now regarding all the MIPS and regulatory topics. You can confirm and subscribe for the NextTech compliance letter. We put that out a couple times a year, and you can definitely make sure that's going into your inbox. And then you can always ask for help and hire a MIPS expert here at NextTech. How do I monitor my MIPS score and make sure that I am getting the max out of my points? So you want to run your quality reports monthly. and really track that MIPS score year to date as it goes throughout the year. Run your PI reports monthly because you want to make sure you're targeting to get that best 180 days possible for that reporting period. You're going to want to address any gaps pretty quickly. You know, that's the thing about MIPS. It is ever changing and it is pivoting quickly. So any big gap any small gap now could be a big gap a few years down the road. You want to make sure that you're just definitely on top of those. Train your staff and follow up to ensure that they're definitely being consistent on the work that they're putting in, and continually check with your EHR vendor for updates on regulatory items, proposed rules, final rules, and as they come out throughout the year. Where can I find training materials for the Next Tech software? In the Next Tech community portal, under training, there is a compliance university section. We have our different products broken out. You can definitely click in there. There's different measure specifications, how to meet the measure, screenshots, documentation available for you to definitely make sure that you are getting the most out of your software. That is all sitting for you then in the compliance university, just as a reminder for you. How do I know what I scored in previous performance years? There is an option to log into the QPP to take a look back. Now, they did adjust some of that data. So currently right now, you can see 2021 and 2022. Each category has full details. You can drill into MIPS and really see exactly what the government has to say on how you're performing in each and every category, and then use that to really make sure that your strategy is trajected to give you the most amount of points possible in 2024. Next, we have, should I apply for a hardship for PI? So if you're a small practice, that's going to be automatically applied. But if you have a decertified EHR technology, if they got decertified this year, insufficient internet activity based upon your region, if you face some kind of extreme or uncontrolled circumstances, such as a natural disaster, practice closed, severe financial distress, or some kind of big vendor issue, that is also a reason. Or if you lack control over the availability of your CHRT software, something happens with your software's CHRT ONC certification, that is also a reason to apply for a hardship for promoting interoperability. Now, are there any hardships for COVID in 2023? That does still exist. However, one of the big things that we have been wanting to preface all of our clients with and everyone that we talk to is that if you, for the first time, they're really starting to look at, if you use COVID, in the event of an audit, they're going to want to come through, they're going to check HR files to make sure that you're having staffing issues. Whatever that reason is for claiming that COVID exclusion, they are going to verify that. They have definitely have said that they're going to start looking at those. So it's no longer just kind of this, well, you know, the exception exists, we can claim it. We would definitely advise you to, if you have the data, to submit it and not just take the COVID exception. Heather, do you want to add anything on that?
I think that's great. I mean, I do think that they're going to tighten out on that and just using it to use it. And I know they approve it very quickly, but if they did come back and audit, you know, they're not looking for a week of data where you had staffing issues. They're going to look for a substantial amount, an extended period of time, 3 months or more of this impacting your inability to collect your quality data. So if it is, and it's truly something still impacting your practice, yes, there's one available, but don't just use it as an easy crutch. In the past, they automatically gave EUC hardships. This one you must apply for, then therefore they could potentially audit. So just kind of understand the difference before just choosing COVID as your option to not report for the 23 reporting year.
Now, common themes and worries. Is it too late to ask for help for MIPS in 2023? I think that we all stand by, you know, it's never too late to ask for help. So there are always options available for you. We offer MIPS health checks where we can get in, take a look at your data, you know, see how everything's going for you. Then, of course, there is some MIPS monitor and master programs for our consulting team. They are subscription based. The monitor gets you, you know, just as it says, a good 30 minutes a month where we log in and help you track your data, both with attestation help. And MIPS Master is going to give you a full hour of one of us a month. It's not just Heather and myself. We have a third Charlie's Angel. Her name is Christy. Of course, some of you work with her. And so anytime that you guys need help, please reach out to your ISM, your internal sales manager, and they can get you in contact with the MIPS team here at Next Tech. Now we're going to line to one last final poll question. Are you interested in receiving assistance for your MIPS strategy to make sure that you are successful within the MIPS program?
All right. Well, I think we've got some feedback there, and looks like we've got, we can move over into a Q&A. And before we do that, one quick thing we wanted to add is we also, for joining us today, have a MIPS to the Max toolkit. All things MIPS in one powerful toolkit. There is a landing link here where you can download our toolkit with the ebook on the 10 tips to maximize MIPS, blog on everything you need to know. There's a MIPS milestone calendar as well as a checklist infographic. So we appreciate you guys joining us today. This is just some added resources to ensure that your MIPS strategy is strong, and you can keep up to date with all the new stuff coming, and make sure you're on par for 23 too. So we can open it up. I know that I haven't seen any questions come in through the question box as we've gone through the presentation. I don't know if anybody has anything now that we've gotten through the bulk of it, or any clarification on the NVPs. I know that's kind of something new. I'm even curious if any of you all have considered doing NVP reporting for your practice. And if you want to, you can just comment in the chat. I don't really have a poll for it, so.
I'm going to think it means you did a great job of explaining things if there's no questions asked.
I was just curious if anybody wanted to consider doing NVP.
Same, yeah. I
It's
think
intriguing to anybody.
That's interesting also, yeah.
Well, I don't know if I'm going to give everybody 10 minutes back in their day. If we really don't have any questions for the Q&A, I can still see some people are in the meeting, so I don't want to jump off and leave it short. But if you guys are good to go, we can go ahead and say thank you for joining us today. Hope you gained some good information and know where you can get some good resources to stay on par for your MIPS. And Megan, thank you. Did a great job. And
Thank you, buddy.
Yeah, I think we're good to go.
All right, enjoy your days.
Take care.